Welcome to a comprehensive look at ureteral obstruction, a condition that can significantly impact kidney function and overall health. Join us as we explore the causes, diagnosis, treatment, and ways to prevent this potentially serious disorder. Ureteral obstruction arises from a variety of factors. These include intrinsic causes like kidney stones lodged in the ureter, blood clots, or ureteral strictures, which are narrowings of the ureter itself. Extrinsic causes involve external compression from tumors in the abdomen or pelvis, enlarged lymph nodes, or even pregnancy. Congenital abnormalities, present from birth, can also lead to ureteral obstruction. Identifying the specific cause is crucial for effective treatment. The pathophysiology of ureteral obstruction is a cascade of events. When urine flow is blocked, pressure builds up in the ureter and, consequently, in the kidney. This back pressure, known as hydrureter and hydronephrosis, can damage the delicate structures of the kidney. Prolonged obstruction can lead to irreversible kidney damage, impaired kidney function, and in severe cases kidney failure. Furthermore, the stagnant urine becomes a breeding ground for infection, increasing the risk of pyelonephritis. Ureteral obstruction can affect people of all ages and genders. The prevalence varies depending on the underlying cause. Kidney stones are a common culprit, and therefore ureteral obstruction is more frequent in populations with a higher incidence of kidney stone disease. Congenital abnormalities are typically diagnosed in infancy or childhood. Obstruction due to tumors or other external compression tends to be more common in older adults. The symptoms of ureteral obstruction vary depending on the location and severity of the blockage, as well as the speed at which it develops. Acute obstruction often presents with sudden, severe flank pain that may radiate to the groin or abdomen. Other symptoms can include nausea, vomiting, blood in the urine, and frequent urination. Chronic obstruction may be more insidious with vague abdominal discomfort, decreased urine output, or recurrent urinary tract infections. In some cases, chronic obstruction may be asymptomatic until kidney damage is significant. Diagnosing ureteral obstruction requires a thorough evaluation. This typically begins with a medical history and physical examination. Imaging studies play a crucial role. Ultrasound is often the first-line investigation, particularly in pregnant women and children. A CT scan without contrast is the gold standard for identifying kidney stones. An intravenous pyelogram, or IVP, uses contrast dye to visualize the urinary tract and identify the location and cause of the obstruction. Additional tests, such as urine analysis and blood tests, may be performed to assess kidney function and detect infection. While not strictly types, ureteral obstruction can be classified based on several factors. These include the location of the obstruction, upper, middle, or lower ureter. It can also be classified based on the degree of obstruction, partial or complete. The duration of the obstruction is also important, acute versus chronic. Finally, as we discussed earlier, classification based on the cause, intrinsic or extrinsic, is vital for guiding treatment strategies. Treatment and management of ureteral obstruction aim to relieve the blockage, preserve kidney function, and prevent complications. The approach depends on the underlying cause, the severity of the obstruction, and the patient's overall health. Pain management is a priority. For kidney stones, options include observation with pain medication for small stones that are likely to pass on their own, or more invasive procedures such as extracorporeal shock wave lithotripsy, ureteroscopy with stone extraction, or percutaneous nephrolithotomy for larger stones. Extrinsic obstructions may require treatment of the underlying cause, such as tumor resection or chemotherapy. Ureteral stents can be placed to bypass the obstruction and allow urine to flow freely. In some cases, surgery may be necessary to repair or reconstruct the ureter. While not always preventable, certain measures can reduce the risk of ureteral obstruction. Staying well hydrated can help prevent kidney stone formation. A balanced diet, low in sodium and animal protein, may also be beneficial. Regular medical checkups can help detect and manage conditions that may lead to ureteral obstruction. Prompt treatment of urinary tract infections can also help prevent complications that may lead to obstruction. The prognosis for ureteral obstruction depends on several factors, including the underlying cause, the duration of the obstruction, and the extent of kidney damage. Early diagnosis and prompt treatment can often restore kidney function and prevent long-term complications. However, prolonged or severe obstruction can lead to irreversible kidney damage and the need for dialysis or kidney transplantation. Recent research focuses on developing less invasive techniques for treating ureteral obstruction and on identifying genetic factors that may predispose individuals to kidney stone formation and other causes of obstruction.